nodule on routine chest x-ray, you always compare it with the previous x-ray from last 2 to 3 years. If nodule is stable, like it's the same as that you see in the previous x-rays, it is just the same stable nodule, no further testing is required. It's most likely a benign thing. But let's suppose if there is no old x-ray, or when you compare it with the old x-ray you can see a growth, then you can proceed forward. Then you can go for the chest CT, do a chest CT. CT will give you a more detail about the nodule size, border, and internal pattern. You can have three interpretations. If it has a benign features, which means that when you look at the nodule on CT, it has smooth, well defined edges, dense central or concentric pattern, smaller in size, usually less than zero point 0.8 are benign. Or then you know that there is no biopsy needed. You can simply follow it with the serial CT scan to ensure the stability. But let's suppose when you do the CT scan, you can find some indeterminate or suspicious features. Like, what could be the suspicious features? Like, the size can be more than or equal to zero point 0.8, from zero point 0.8 to 2 centimeter. The size is big. When you look at the structure, it's irregular, or you can see the speculated margins. You can see concentric calcification or partially solid nodule. Then you can say, like, oh, this is something suspicious or indeterminate. What should be the plan? You will plan the further testing. You can either go for the PET scan to assess the metabolic activity, or you can do the biopsy. It depends on we have two types of biopsy options, bronchoscopic or percutaneous. We'll opt for one depending on the location. Then we have highly suspicious ones. When we label it as highly suspicious, if the size is more than 2 centimeter with speculated edges, it is non-calcified, rapid growth on serial imaging, we label it as a highly suspicious. What's the plan? You go straight for surgical excision, you do not delay. Clear?
Okay.
PET scan is a word that we use a lot of times. Basically, what is PET scan?